a stabilization in the number of people tested positive to the COVID-19 and the stabilization of number of people being hospitalized, and maybe a little hope in people transferred in ICU, which is on 10% less than the other days. So we still have people going to the hospital. We still have people testing positive. We still have severe cases. By the number of people dying and the number of people going to the ICU is declining.
Syamak Agha Babaei, when you first saw the cases coming out of China, coming out of Italy, did you think Alsace would be hit so hard?
No, never. We had the same image at first, the image that we had from SARS or from MERS in the early 2000s, and we thought that we can have something about maybe 10 cases in Strasbourg, and then in something like a week, we saw people coming. We saw first elderly people, and then younger people with very severe cases, and we saw people dying, and we saw people being transferred to ICU units, the need of ICU beds, and then we were really to thank our German colleagues to have accepted transfers of patients in the ICU beds and permitting us continuing doing our job and saving people for the remaining ICU beds. So that was really a really great act, and I want to thank German people, German authorities, and German colleagues. What we need now, and when I heard the discussion between our two invitees, is that what can European Union do for European people? What we need to hear is that what Europe does mean to me. What can it change? How Europe can change our healthcare system? How Europe can change the situation of the people who have lost their job, entrepreneurs? How Europe can help people who are homeless? So how we can move from what was the vision of economic Europe? How can we move forward to a more integrated, maybe more federal, and maybe more political Europe, which in which the social part and the ecological questions will be, I think, what we most need in the next years.